My name is Axel Hoffmann. I'm co-organizer of the summer school from the Swiss Tropical and Public Health Institute, together with my colleagues from USI here in Lugano and the SSPH Plus. It's a pleasure to me to introduce to you Erika Platchella. She's the deputy head of the global program health at the Swiss Agency for Development and Cooperation in Bern. And before she was working, or always in between, for SDC, she worked also for many organizations like Médecins Sans Frontières, the International Committee of the Red Cross, UNHCR, WHO, UNFPA, and so on. And her technical expertise, at least Erika, you can correct me, I was reading about, is of course primary healthcare, and then also non-communicable diseases. But I think with the COVID-19 pandemic, you have also a lot of experience and expertise in communicable diseases. So Erika, thank you very much for accepting the invitation for this plenary session, and the floor is yours.
Yes, good afternoon, and thanks for the invitation and the opportunity actually to share an overview of the context, and as you will see, with some interesting changes of paradigm and shift, which of course will have important consequences on global and international cooperation in health. And also I will share with you some elements on the Swiss Agency for Development and Cooperation health response this year and next year. So now I have to share my screen, so I will do it, and I hope it works. Mm-hmm. And you will see a first slide. Just a second. It's blocked. So I close it, I'm sorry. So can you see the first slide?
Yes.
So it's just a slide with the title of the presentation. And so I would like to start with some background information, actually. So as you know, disaster risk is rising mainly due to urbanization, population growth and mobility, poverty, climate change as well, and trade intensification, etc. So you also know that these disasters are increasingly complex and interconnected, and but however, at the same time, in both high-income countries and low and middle-income countries, the global risk preparedness is quite low, as reported here, as you can see on your screen, as it was reported in May in the Global Health Security Index score. And you can see here, I mean, that this preparedness is very low in most of the African countries. So, and at the same time, and among those risks, let's say the risk of spread of highly infectious diseases such as COVID-19, Ebola, or cholera is also increasing with the intensification of international travel, trade and livestock transactions and movements, as well as the increase in population density. And well, you know that in addition to the many casualties, epidemics, pandemics such as COVID-19 cause significant socioeconomic damage in most of the countries. The IMF predicts, in fact, the worst recession in its history for Africa, for example. And according to the World Food Programme, the number of severely hungry people could double to more than 220 million by the end of 2020. And also for the first time in 20 years, the World Bank predicts an increase in extreme poverty. And of course, the impact of such pandemics is particularly high in low and middle income countries whose health system and social safety nets are already weak. So, and you know that COVID has a significant social gradient. It means that disasters can exacerbate existing health inequities. In other words, COVID-19 increases inequality, exclusion, and protection needs, especially for vulnerable groups such as refugees, migrants, and internally displaced persons. And it's also obvious that deteriorating living conditions can lead to a breakdown in social cohesion and even political tensions or instability. And of course, cultural values, our cultural values and references, patterns of thought, and even working methods, working organization are also challenged by COVID-19, are also challenged by paradigm shift induced by COVID-19. In fact, the world faces a new normal we have now to adapt to. Here you have a very nice representation of the history of pandemics. And what I wanted to say here is that for the first time, and this is very specific and it marks a huge change of paradigms, for the first time in the history of epidemics and pandemics, the economy has been shut down to save lives. In other words, an economic crisis has been artificially created to save lives. So it really demonstrates that the COVID-19 crisis demonstrates that wealth and health are interconnected. And of course, it means that there is no health without health. And this has been for the first time in the history of pandemics. It's the first time there has been such a, everybody agreed on shutting down, at least for 1.5 months, shutting down the economy to save life and to, of course, to allow containment measures to happen and to work. Actually, in the face of this scourge, despite the sophistication of our high-tech health systems, the world is discovering, I would say, rediscovering basic public health measures. Basically, these functions and measures are the same that were used for the London Great Plague, for example, such as, for example, here, wearing masks, called the plague doctors, or washing hands, or physical social distancing. So the COVID-19 pandemic marks a paradigm shift at different levels. In fact, most health systems were unprepared and showed low resilience, including in our countries, including in high-income countries. Here, for example, a picture of a triage center organized in an airplane garage in Bergamo, Italy. Another paradigm shift, Médecins Sans Frontières, which traditionally works in low income countries, launched a program in Geneva consisting in supporting the Geneva Hospital, University Hospital, in, for example, dealing with highly infectious diseases. And it's consisting in, for example, organizing intensive care units, introducing appropriate healthcare workers' protection measures, triage, etc. And this also is also a paradigm shift. The COVID-19 pandemic takes place in a context of global power shift and changing alliances in global health. So, and this complex environment is being further challenged by the paradigm shift in international cooperation dynamics induced by the pandemics. High-income countries, as I say, that traditionally lead the global health debate are faced and are still facing the same problems as low and middle income countries, and how somehow we are high-income countries are somehow learning from low and middle-income countries how to address highly infectious diseases, especially in hospital settings. This was the case, as we saw with MSF in Geneva, but also here in Italy with China medical rescue teams who were deployed in the Bergamo area. Further, the COVID-19 pandemic response boosts China's increasing role in global health over the last year. So it also kind of boosts the role of China in addressing global health and global health security issues. So, and the COVID-19 also represents a paradigm shift for WHO, and the questioning of its role and mandate and coordination role, especially by USA, as you know, as you have seen. And COVID-19, now getting back to Europe, COVID-19 also offered the opportunity for EU Commission to come together and to define a strong health response. For example, when it comes to diagnostics, vaccines and therapeutics, and all sorts of initiatives have been launched by the European Commission, for example, together with WHO, the ACT Accelerator, or the vaccine facility. Now, of course, addressing transboundary diseases in a retrenchment area we are living in faces, of course, many challenges, as you can guess. And also a lot has been written and discussed about the effectiveness of measures in democratic and or authoritarian political environments. For low and middle income countries, particularly, basic public health functions can still not be performed, such as, for example, hand washing or social distancing. Now, SDC response. So our institutional framework is very broad. So we have a lot of, let's say, institutional documents and strategies which focus on pandemic preparedness. For example, Switzerland International Cooperation Strategy 2021-2024 places greater emphasis on the equitable access to quality basic services, including, of course, emergency services in the area of health. And the Switzerland Foreign Health Policy 2019-2024 also aims to strengthen the resilience of health systems to health shocks such as pandemics. And finally, the third institutional framework is the so-called SDC Health Policy, which puts the prevention of epidemics in low and middle income countries at the centers. In most of the countries, low and middle income countries, and especially those who are weakened, have been weakened or are weakened by conflicts and other chronic diseases. And thanks to, I would say, its strategic role in global health and the presence in the countries and the positioning in global health, having access to WHO, to other global health arenas, and also the presence in the health sector in very countries and the flexibility of these instruments. So global cooperation, country cooperation, negotiating at the global level, supporting NGOs with program contribution. These instruments we use to provide help have a lot of flexibility and can be pulled together to provide a comprehensive response. So thanks to this flexibility, Switzerland was able to quickly contribute to the fight against the pandemic. And the Federal Council decided to respond to various appeals. You have seen how many appeals this COVID-19 has had. I mean, from international organizations, forum, being it UN, ICRC, G20, etc. And the Federal Council, mid-May, has approved 400 million Swiss francs support, an amount of 400 million distributed as follows. So there, first of all, an interest loan of 200 million to the International Committee of the Red Cross. So that's a loan. And then 25 millions to the IMF Disaster Relief and Response Fund. And then other contributions to ICRC, the International Federation of Red Cross and Red Crescent Societies, and the access to COVID-19 accelerator initiative for diagnostics, therapies, and vaccines, as well as contribution from bilateral development cooperation and humanitarian aid for an amount totaling 175 million. So in addition to that, to these new credits of 400 million Swiss francs, various ongoing programs financed from the existing budget have been adapted to integrate a crisis response. For example, just a few examples, in Burkina Faso and Chad, kits for the local production of disinfection solutions have been provided to various health facilities. In Kosovo, awareness raising messages have been developed and disseminated to the population, targeting, of course, the most vulnerable communities. And then last but not least, Swiss-based NGOs supported by SDC, that those who are, which are receiving program contribution are also adapting their activities to the crisis. And just a few examples here as well. In Bangladesh, Benin and Haiti, for example, Médecins du Monde Suisse is supporting the development of national pandemic plans with awareness rising and prevention measures in community settings. So that's for the SDC response. Now some figures. You have here what has been engaged so far. So engaged, not approved, but already engaged. So you have this, the first line is the additional credits I was referring to, together with the second line, 200 millions, which is the loan for ICRC, and then the third amount, the third figure here is for the ongoing programs which have been adapted, and here it's an estimation of the volume of adaptation, let's say, due to COVID-related issues. So as of 10 of August, we have contributed to the COVID response just for the, I mean, this includes, it's not only the health part, but it also includes, of course, the social and economic consequences for more than 500,000, 500 million Swiss francs. Here you have the breakdown, so you can see that Africa is the most, of course, it's because we do have a lot of not only health programs, but also social development and vocational training and economic development programs in Africa. So, so you see the breakdown, mainly the most of the means were put in Africa, but also the global response. You can see here the last figure. And that's our health response. So that's only for the, I would say, the additional credit we got from the Federal Council. So you see here that we have 113 million Swiss francs. And it's the breakdown is 30 million for Gavi, that's for the vaccine response. Then you have for humanitarian aid, almost 50 million. WHO, that's for Latin America, and Caribbeans. And then you have the tools, you have here, just here in yellow, you have the therapeutics and the diagnostics. So now I would say that our global framework for these investments, our global framework for action includes, it's mainly based on the WHO International Health Regulations, IRC, so-called IHR, and we support, SDC supports the implementation of IHR and other health security instruments, for example, the Sendai framework in several low and middle income countries. And so, for example, humanitarian aid provides protective equipment for health personnel, materials, and essential medical products. Our support, SDC support, aims to improving the capacity of national and local authorities to prevent, detect, and provide a coordinated response to epidemics. It includes, for example, limiting the risk of international spread of the disease by strengthening the response capacities at airports, ports, or border crossings. And we also, international cooperation and multilateralism are also crucial to address COVID-19 and more generally transboundary diseases. And thanks to multilateral cooperation, SDC could quickly provide support and engage in global negotiations in Geneva, but also in New York. As you have seen how many resolutions, statements, letters, non-papers, white paper, etc., have been elaborated and have been approved and have been negotiated in the global arena. And we have been part of it, we have contributed, and we have tried to have a kind of, to ensure that we have a kind of coherence between what we do in Switzerland and what we promote through our international cooperation, which is not always obvious, because there are some interests which are not always aligned and I would say are very difficult to combine. So the whole of government approach is not as easy as it should be. Let's put it like this. So, and well, of course, before COVID-19, we were already, we had a kind of very strong position in global health in the discussion and the negotiation with China along the Silk Road. And thanks to our strategic role and positioning in global health, our support for strengthening health system, including their, as I say, their core public health function in several low and middle income countries. And as I said before, the flexibility of this instrument, we were able to make a very rapid contribution to the fight against the COVID-19. And we used, of course, priorities. We tried to use priorities based on Switzerland's comparative advantage and expertise in the prevention and management of health crises. And for example, in the frame of this initiative along the Belt and Road initiative, regional and global dialogues and partnerships have been engaged to advance cross-border collaboration in the Belt and Road space on health security, and in partnership with the WHO. Even before the outbreak, as I said, SDC was helping to strengthen the capacities of countries along the new Silk Road in Central Asia, but also in Africa, to mitigate the risks of spreading epidemics linked to cross-border trade and increased human mobility. So we were able to very quick to react very quickly and to, in the frame of this Belt and Road, making the most of Belt and Road for Global Health. That's the title of the initiative. We very rapidly, we could, for example, support Laos in getting pandemic preparedness plans ready, or Cambodia, for example. These are just two examples, but we got also requests for support from Uganda and from Kenya. So now, getting back to the health response. So our response is, we have two focuses. The first focus, is on strengthening health systems, and I will come back on my last slide on that. But I wanted to spend some words on our health R&D response, because that's the second focus we had, and we used the additional credit we got from the Federal Council in May. So for SDC, improving access to quality, safe, efficacious, and affordable medical products and technology, including, of course, by investing in research and development and encouraging innovation, is essential, of course, to address global health challenges such as COVID. And in addition, it is imperative to establish and ensure fair principle for equitable access, of course, to these products, particularly in low and middle income countries. And that's where we face risks of incoherence with the kind of strategy we have here in Switzerland at the moment. So the SDC has responded to the call of WHO, the G20, as I said, and the European Commission by contributing to accelerate to development, the production and the equitable access to diagnostics, therapies, and vaccines against COVID-19. And I insist on these three pillars, because it's not just about vaccines, it's about the three pillars which have to be somehow played together, and diagnostics and therapies are very, very important in settings where it's almost impossible to vaccinate the entire population, such as in most African countries. So it's very important to support these three pillars and not just focusing on vaccines, and because it's important, of course, for high-income countries. So, and these investments, of course, in the three pillars are based on Switzerland's comparative advantage, of course, and interests. And one of these interests is, of course, Switzerland's own interest in preventing and responding to highly infectious cross-border diseases to protect its own population, of course, but also on the Switzerland prestige and reputation as one of the world's leading clinical and public health science centers, and as a country, of course, of pharmaceutical and biotechnological research. And last but not least, the Swiss pharmaceutical industry expertise in diagnostics and medicines. And actually, Switzerland has not been very strong when it comes to vaccines. So speaking about the Swiss interest is also, it's also important to recognize the importance for Switzerland for diagnostics and therapies. So, and then the second focus, of course, is on health system strengthening. This is at the core, beyond COVID-19, is really at the core of SDC strategy. It's not very easy to explain what it consists in. It's not very sexy to say that we focus on health system strengthening. It's more sexy to say we focus on pandemics, or we focus on non-communicable diseases, but definitely our aim is to strengthen health systems. So in our view, health systems must be further developed in such a way that they not only provide more essential services to more people and protect them from financial hardship, but also consistently provide competent care, can adapt to changing contexts and respond to health shocks, of course, such as pandemics. So hence, health systems resilience is key to both UHC and global health security, as you can see here on this action framework. SDC is, for example, just a few examples to illustrate this. We are, for example, contributing to the strengthening of health system for the prevention, surveillance, control, and response to COVID-19 in Laos, as I said, from our Belt and Road Initiative, and in the Horn of Africa region, in particular through the provision of reliable screening tests And in Tanzania and in Eastern DRC, we support the improvement of local capacities for social mobilization of communities and communication to the risks, to the communication of the risks linked to the virus. This includes, of course, raising awareness on social distancing, hand washing, as we saw, by broadcasting, for example, radio messages in local languages, or distributing information brochures with pictograms to make it easier to understand and comply with the recommendations. And for SDC, we are aware that pandemics such as COVID-19 require much more than just a health response, even if our aim is to strengthen health system. In addition to strengthening health systems, including their core public health function, it is essential to address health determinants, such as water, sanitation, nutrition, or education, to cope with the social and economic consequences caused by viruses of such magnitude. Well, as you have seen, in COVID-19 pandemics have shown that in various countries that has shown that such a crisis is more severe if people have no health literacy, for example, to protect.
Erika, you're back now. We hear it.
Yes, I'm sorry. I think because I didn't, like shift from one slide to another, I think the computer, as I said, the computer belongs to a friend and I don't know how to.
Don't worry.
So no, I was referring to the importance of determinants of health and referring to mentioning that such a crisis is more severe if people have no health literacy to protect themselves, or basic social security, or decent jobs, for example, that allow them to for example, to respect lockdown policies. And in the event of epidemic, a health literate population is able, as we see in Switzerland with most of the population, a health literate population is able to understand how to protect themselves and others through, of course, simple actions such as physical distancing or hand washing. And SDC, just an example, SDC Health Promotion Program in Cabo Delgado in Mozambique, for example, provides health centers with hand washing kits containing a soap bucket with a tap and a basin, etc. So this is it, basically, as you have seen. So we have not only a health response, but the entire institution is somehow trying to get fit for purpose and to adapt their programs. And definitely what I can say is that health, finally, I have the impression that now everybody, including at the top of the organization, is very aware that there is no wealth without health, and that health is not just about diseases, is really about economy, is about education, is about stability, is about financing, is about negotiating agreements which can protect the population beyond health issues. And my hope is that this will that we will be able to somehow extract some good practices and trying to mainstream I mean, some good practices which can really inspire us for future strategies, not only for health, but also for education and for economic development and for vocational training, for example, for governance, because it's also a governance issue. I mean, dealing with global health security issue is about dealing, is really about dealing, it's about health governance, it's about global health governance, it's about institutional governance, it's about UN reforms, about WHO reforms. So that's my message. My last message is that I think that of course, COVID-19 was a stress test for the entire international cooperation community. But for SDC, definitely it brought health in a broader sense. I mean, health with all its determinants at the center and at the core of our interventions. And not just, and I really hope that we will now, we have that everybody understands about this new language and new understanding about health beyond pure, I would say, medical and disease-related issues. And so that's my last statement. Thanks.
Thank you very much.
Can you hear me?
Yes, can you hear me?
Yes, Axel,
Yes.
I can hear you.
Yes, Erika, thank you so much for your very, very important and very interesting presentation. And we would like to invite the participants to use the Q&A function. And until they write, I would like to ask you or pose a question to you, Erika. And it might be provocative, but not provocative to you or SDC. I think provocative to all of us who are dealing with global health. And I want to cite a colleague, Sarah Douglas from Johns Hopkins University.
Mm-hmm.
She stated on 26 March this year in the correspondence section of The Lancet, an article, short article, one-pager, saying, COVID-19 gives the lie to global health expertise. And she was giving this example of the Global Health Security Index from 2019, where the US and the UK were ranked #1 and #2 in their capacity to face infectious disease outbreaks. Now, we all know these two countries perhaps have shown the worst response or one of the worst response to that. So first question is, where do you see Switzerland in that? Because I mean, also internally in Switzerland, we have to say not everything was functioning quite well. And how can you explain that these health systems have not been prepared? We are teaching to colleagues in so-called developing countries how they should be prepared to disease outbreaks. And then when we look at our countries, we have to state we can also improve. So Erika, are you still there? She's frozen. Yeah, perhaps I try Erika. So Erika dropped out. Perhaps she will come back. So Susan, there seems to be one question. Is that right in the Q&A?
There is a question in the Q&A for Erika when she comes back. Occasionally Zoom does this. It just kicks you out and restarts. So that'll happen in a moment. I just wanted to comment while we wait for her to hopefully rejoin. I wanted to comment on your question or your comment actually, Axel, and that is that, and because this was also raised in the morning session with Marcel Tanner, one of the participants asked, you know, it seems that we're just kind of copy and pasting responses from high-income countries to low-income countries. And as you said, I kind of look at you because you're here in the same room, far from me, but in the same room. We also know that high-income countries are not necessarily getting this right either. Mm-hmm. So we need some localized responses. Mm-hmm. I don't see Erika. But I can read one of the questions that is in our Q&A session. So whenever you all are entering questions, then Axel and I can see that. This is from Lucia Aguirre from Colombia, who is studying here in Switzerland. One could argue that risk preparedness meant different things before and after COVID-19 pandemic. Some countries may have been very well prepared for a crisis like war or even nuclear accidents, but not a pandemic. For example, a bomb shelter in every house would be a great advantage for some kinds of risks, but not for pandemics. Do you believe, or have you observed, if there are any countries that would not normally be considered vulnerable or badly prepared for risks, but that are more vulnerable in pandemic terms? It's a great question, Lucia. And I do agree with you. Axel, do you want to try to answer that question for Erika?
No, I definitely not answer for SDC. That would not be correct. No, but what I wanted to say is the good thing on this Q&A is also that, I mean, Erika is now not with us. She dropped out, but we can send her these questions, and we will then try to post it on our Moodle site of the summer school on the first page where everybody has access. Is Erika back?
Yes, back. I'm back. I'm sorry. As I said, I had some challenges with this PC.
Okay, no problem.
Somehow I was like, you know,
and
it was completely, the screen was black and I had to, well, so I'm here. So the question was about Switzerland. Is it correct? About
I mean, really the capacity to face infections.
Now I cannot hear you.
You can't hear me? Can you hear me? Erika? Can you try?
Erika, can you hear me? Erika, can you hear me now?
No. She's not connected to any audio.
Okay.
Okay, she can't hear us. She's writing in the chat.
Okay, and everybody else online around the world, you all can hear Axel and I, that's for sure. I've seen the chats and the Q&A, so thank you. Let's see.
Okay, so then.
And I think and most countries have some type of risk preparedness plan. For example, Switzerland had a risk preparedness plan that they published in 2015 that had listed pandemic as the third most likely risk to affect Switzerland in the coming years. I can't tell you exact number of years, but you can read it from the report. And I can't say that I can't say that Switzerland was really prepared for this. I don't know that any country was really prepared for this, even if they did have good planning. Let's see if we can get Erika's perspective on that.
Yes, now I can hear you. Can you hear me?
Yes, we can.
Finally, I'm so sorry. I mean,
don't worry. We're all in this together, Erika. As somebody wrote me in the chat.
As I say, the challenging, COVID is challenging our way of working.
Indeed, indeed. Erika, did you hear the second question or just the first question?
No, I heard the first one, but can you see me? Because the camera doesn't work anymore.
No, we can't see you, but we can clearly hear you and understand.
That's good. So I did. Can you repeat the second question, please?
One could argue that risk preparedness meant different things before and after COVID-19 pandemic. Some countries may have been very well prepared for a crisis like war or even nuclear accidents, but not a pandemic. Do you believe, or have you observed, if there are any countries that would not normally have been considered vulnerable or badly prepared for risks, but are now more vulnerable in pandemic terms?
Okay. So the first one was about Switzerland and, well, the way we were prepared. But as I said, I mean, you saw on the slide, I was very surprised by the mission launched by MSF here in Geneva. Actually, I have a friend working at the HUG, and he told me that it was so difficult for them. You know how sophisticated our system is. They didn't know how to deal with highly infectious diseases. Mm-hmm. So all through the system is they had acute beds, they had everything, including masks, despite of what has been reported in the media. They had masks, they had ventilators, etc. But they didn't know how to deal with that, how to do the triage correctly. So it really shows that we were not prepared. Switzerland was not prepared. As you know, we have a law in Switzerland which says that, for example, that we have to have at home, everyone has to have 50 masks, 50 it's part of the law. Every single home for the elderly has to have a stock of masks, etc. But this was not in place because in Switzerland, this law is in place, but there is no mechanism for enforcement. And there are no resources. There is no specific budget dedicated to I would say to the prevention and to the the resources and the material which has to be available at facility level. So we had a material challenge because we depend too much from outside, that's clear. And mm-hmm. COVID also challenges our economic system, the way our health system works. The extent we depend from outside, for example, for every single piece of a test, we depend for reagents, we depend from Spain. For the glass, a small glass, we depend from the north of Italy. So for every single item, we depend from outside. And it really shows that despite this law is in place, the entire economic system around it is not ready to make it possible for this law and these measures to be introduced and to be implemented. So we were not ready. And I really hope now that we will be able to get some lessons, and there will be, as you know, there is an intention from WHO and the global health community to update the international health regulation, and I really think they have to be updated. For example, there is currently in the international health regulation, there are no measures related to for example, to the infodemics, to, how you report in social media, how you speak about COVID, who is right, for example, these kind of issues. And also, still for international health regulation, the transboundary transboundary measures in the international health regulations are not implemented. So at the country levels, some of these measures are implemented, including in Switzerland, but the transboundary parts are not implemented. And that's the part where that's the most, I would say that's the most important part, as you can imagine, for a highly infectious disease. This is the most important part. It's not just about retrenchment, about sanitary and health security issues at the country level. But this virus has no borders, as everybody knows and says. But the international health regulation, they have specific measures which pertain to, which are not related to one specific country, but which, which make, which are based on the commitment of the global health community to contribute to health security, for example, at the airports, or when it comes to trade and all these issues around, you know, for example, animal transactions, etc. So it's very important, including for Switzerland, to implement, to continue to implement the international health regulations, which is actually not the case, including for Switzerland, and not mentioning other countries in Africa and in Asia as well.
Mhm. Okay.
So the second question was about whether countries are more ready to. What I noticed is that in countries in the Belt and Road space, I would say in the Asian region, what I see is that there is a kind of awareness of now the need to really to implement the international health regulations and to somehow to get prepared for the next pandemic. And it's also because, I mean, China is investing a lot of resources in those countries, including for health system strengthening and pandemic preparedness, and especially when it comes to infrastructure. I mean, laboratories, testing facilities, etc. So I see that those countries are more, I would say, more aware, they are showing a kind of interest to get more ready for the next pandemic and to implement the international health regulation. And I also see this kind of commitment and interest in the global health fora. For example, at the World Health Assembly level, in various negotiations in New York and in Geneva. So my impression is that there is a kind of awareness in the Asian, I would say, world that something needs to be done, and it also seems that there is less retrenchment than in European countries, for example, where it really all countries implement the international health regulation at the country level, but there is no commitment for transboundary. I mean, it doesn't go beyond sharing masks and, you know, like offering ventilators, or it doesn't go beyond that. And that's the problem. We are not going to solve this transboundary disease with sharing of masks and even, you know, like hosting patients in Swiss hospitals. So it needs more commitment. And again, the key framework, the key instrument is the international health regulations.
Okay. Thank you. Is there any other Q&A I can't see? I have no update.
I have one other question in the Q&A session for you, Erika, and that is, the way that you assess risk preparedness now, has that changed for SDC since COVID has come into our world?
Yes, because, you know, we were discussing, we did a lot of work around disaster risk preparedness, Sendai framework, etc. But we were not really integrating pandemics in that reflection and in that framework. So we have started now, I mean, from one side to address pandemic preparedness in the frame of our health response. And then to address pandemic preparedness through, I mean, adapting our programs in economic development or vocational training, education. And then there is a third pillar, I would say, which is, we did a lot of work around disaster risk preparedness, disaster risk reduction, let's say. And so far it was mainly, I would say, just around, you know, water, chemicals, you know, this kind of earthquakes and this kind of natural disasters. But now we have, actually we updated our strategy and we integrated it, I mean, pandemic preparedness related issues into this strategy. But as I said, I mean, the entire organization and I would say intervention framework is affected by COVID, will change because of COVID. So it goes really beyond health. It's about, as I said, governance. It's about gender. We also revised, updated our gender strategy, for example, in light of COVID. Governance, as I said, education as well. So the entire organization is somehow changing and well, focusing on preparedness, being it for pure, disease-related issues or for consequences such as education, etc.
Okay. Thank you. There is no more question, Susan.
No, I don't have
And
any.
we are nearly at the end of our time slot. So I would suggest then that we stop here. Thanking very much again to you, Erika, for the time you have taken, for the topic you have chosen. And I'm sure that it was very important for the participants of this of this plenary session to see also how the Swiss Agency for Cooperation is working with COVID. And I think what I not learned, but I think one of the take-home messages is the big hope from your side also that health is really seen as the resource we need also for all the
Exactly,
other
it's an
things.
investment.
Yeah,
It's an
it's an
investment.
investment.
It's not a cost. It's an investment, and that's the
Exactly.
paradigm shift I really hope COVID-19 has brought to our organization. But beyond our organization,
Yeah.
I would say my hope goes to the entire global health community.
Mhm. Yes, and I think we at least we here in the room or in this building we can say yes, we would like to share your hope and to see that after many years when health was or the investment in health was decreasing in cooperation,
Exactly.
I hope that it will increase again and in a way you pointed it out. So thank you very much,
You're
Erika.
welcome. Thank you. Bye-bye to all of you.
Bye bye to all of you.
Bye.
Bye.
Thanks, everyone. Bye-bye.